Lumbar puncture can be performed with the patient either lying on their side or sitting upright. This is a sterile procedure and requires sterile gloves and sterile drapes. If measurement of opening pressure is required, the lying position is preferred. Use the smallest gauge needle possible, as the risk of post-lumbar puncture headache increases with larger needle size. Required equipment includes a lumbar puncture tray, an extra spinal needle, and labels for sample collection. For patient preparation, the lateral recumbent position is preferred, with the spine parallel to the bed. An alternative position is the upright sitting position, with hips flexed and feet supported on a stool. Clean the skin thoroughly with chlorhexidine and maintain sterile technique throughout the procedure. The preferred puncture sites are L3 to L4 or L4 to L5. The iliac crests correspond to the level of the L4 vertebral body and help identify the correct landmark. Begin the procedure by positioning the patient properly and flexing the spine to open the intervertebral spaces. Identify and mark the anatomic landmarks, including the midline and the level of the iliac crests. Prepare the skin using antiseptic solution, applying it in a circular motion and gradually increasing the area of coverage. Apply a sterile drape. Create a small wheel of local anesthetic at the skin overlying the entry site. Then infiltrate anesthetic into the deeper tissues. Insert the spinal needle in the midline, keeping the bevel parallel to the dural fibers. Advance the needle slowly toward the umbilicus. Periodically remove the stylet to check for cerebrospinal fluid. When the subarachnoid space is entered, CSF will flow from the needle hub. If required, attach the manometer and measure the opening pressure. Collect cerebrospinal fluid samples sequentially in numbered tubes. Approximately 1 milliliter is collected in tubes 1 through 3, and 3 to 4 milliliters are collected in tube 4. After sample collection, remove the needle and apply a bandage over the puncture site. Following the procedure, keep the patient in a flat position. Ensure all sample tubes are labeled before leaving the patient's room, and place them in a biohazard bag for transport.